pia na kucheza, mawingu inafutika, akili yako itulie kama maji ya ziwa, furaha inakujia bila hata hila. Twende sasa, tusonge mbele, nguvu zetu zishinde vikwazo, fanya mabadiliko. Leo ni siku yako, ipe moyo, tembea kwa mwanga, fanya mabadiliko. Nguvu zako zinatosha, pamoja tunaweza bila shaka. Wezi ni mbegu, afya ni mti, ikimbia na kucheza, mawingu yanafutika. Akili yako itulie kama maji ya ziwa, furaha inakujia bila hata hila. Twinda shaka,
Well, ladies and gentlemen, thank you very much for joining. I know we're starting off a couple of minutes into the session, but we still have some people, please, um, just joining in. So we'll give them another 3 minutes. Sorry for taking 10 minutes of your precious time, but we thought slight music at the back would be a little bit more entertaining, just to make sure we're not that serious early in the morning. But I'm going to be your host for today. And if you're on this call, it's because you understand what's going on within the sexual and reproductive health space and you're interested on this particular project that we're doing, but also you're a SRHR champion or advocate, or you're 16 to 35 years, and that's the reason why you're interested in this discussion. So, ladies and gentlemen, welcome to the Solutions for Supporting Healthy Adolescents' Rights and Protection. We're abbreviated as SHAP, and it's an EU-funded project going on for 4 years. We actually started our last year, and we were thinking, you know what, it's good to have a lot of SRHR champions within the African context. I need to highlight that this particular discussion will be the first workshop, and it's fully run in English. We will have another workshop for our Francophone speaking team later on within the year. Next slide, please. There I am. So I think we've already bumped into each other in one space or the other. My name is Miss Lizzie Otai, and I'm a development communications expert, but also the communications consultant for ENASO. I'm based in Nairobi, and yes, ENASO is also an abbreviation, but we're headquartered in Arusha, Tanzania, and our main business is health, especially advocating for health within the Anglophone and Francophone and Lusophone speaking countries. Next slide, please. I'm working from home, so I might as well apologize for my neighbor's kid at the back. Um, so the reason why we're here is because we're trying to have a conversation on people that we can work with, people we've worked with, and people who we call our champions. So today's workshop, which is the first of the three, is under the theme of role of national human rights institutions in realization of adolescent sexual and reproductive health. And the reason why we're having this discussion is because human rights institutions play a key role, especially when issues do not get the mileage that they deserve. So if you're working in within the SRHR space, you have issues and you feel like maybe the police or the government is not giving a keen eye, these are the guys you're supposed to be working directly with. Next slide, please. A bit of house rules. You know how we do this. You're all muted. You have your videos on. Uh, Feel free to actually use the Q&A. If you have any question or comments you'd want to make, use the chat to introduce yourself. And as I mentioned, the reason why you're here, it's because you're interested in the workshops. And of course, you're interested in getting a certificate at the end of it. Please always be on mute unless you're responding to a question or you're giving your compliments or your 2 cents. But you've subscribed to being an adolescent sharp champion. So that automatically meant you've given us permission to record this particular deliberation. Rename your account so that we can call you with the appropriate name. And because this is a free space, we want you to respect each other's input. We don't know all the answers, but somebody might have an answer to a question you've been having a hard time with. But yes, so it's 16 to 35 years. These are adolescents, these are youth. So we expect you to have fun with the discussions. It won't be that serious, but we do have serious people, especially the human rights institutions are very serious when they're talking about human rights. But for us as the SHAP consortium, because this particular deliberation is coming from the consortium communication side, we want you to network. We have our team here who are going to also look into your chats and comments and respond as soon as they can. Next slide. The reason why you're here, it's definitely because you saw this doing rounds on social media, on our WhatsApp platforms, etc. Our partners have been circulating this so that we can ensure that we have um, adolescents champion, youth champions who are going to be carrying the brand Sharp Champions. And we'll explain more what Sharp is. Next slide, please. So this particular project, as I mentioned earlier it's on its fourth year, so it's the last leg. But the beauty is we've done a lot of work and we have a lot of research and, data to back up the work we've been doing in the last 3 years. So the SHARP project is being implemented in 6 countries. As you see on the screen, we're in Kenya, Zambia, Tanzania, DRC, Rwanda, and Burundi. And the team members are also here. They will drop their communication details on the chat so that if you come from any of this country, please feel free to reach out to them. Now, we do have champions who are also backing up. The people we work with within this project, who we call our champions, are adolescents themselves, of course. Faith leaders, we're also working with people from the faith, opinion leaders and policymakers, and of course, our favorite people who are mass and social media influencers. And they're the ones who are also going to moderate this particular space. Now, so far in a snippet, what have we achieved within the 3 years? We've done tremendous and a lot of research and findings that we've published already. And the team, as we go, will share the link. We want you to use these resources as much as you can. We've submitted abstracts, we've attended events, we've gotten some abstracts that have been accepted, some rejected, you know how it is. But we've done a lot of advocacy, and this advocacy has reached thousands of people. We also engage members of parliament, believe it or not, and they're very proactive when it comes to the project itself. And in our fourth year, we've decided we're going to take a bit of a twist with storytelling. So if you feel like this is something of interest to you, please reach out to the team members within your country and we can explore areas of working together around storytelling. Now, I will be sacked if I do not mention that the SHAP project is fully supported by the European Union. And we appreciate the support that we've gotten all over the years. And we look forward to working with you in our last year, which is the fourth year that will actually be concluding as of April 2026. Next slide, please. And of course, as I mentioned, we have partners in the 6 countries. And of course, the overall partner who looks into making sure the consortium is working and having everything that they need is the Health Action International based in the Netherlands. So we appreciate your support, Hi team. And of course, we have NANRI, who's overseeing anything the human rights are doing. We have MEDRAP in Zambia. NANRI is headquartered in Nairobi, but their tentacles spread across the African continent. Then we have Rwanda NGO from Rwanda, CAFCO from DRC Congo, Tweete Zimbere, who are also here. Lewis is in the room, and of course, ENASO. So Tweete Zimbere is from Burundi. Next slide. Now, ladies and gentlemen, if you've come across me moderating, I talk too much, which is not a good thing. And I was just supposed to introduce this and hand it over to, as I mentioned, yes, we're working with mass and social media people who know their things, and they're the ones who are going to moderate this particular session. So I'm going to hand it over to two lovely ladies. The first one is Ida Muntazi. You bumped into her. If you're Kenyan, her Facebook, Instagram accounts are off the chain because she does a lot of SRHR interesting videos and content in her space. Then we have Irene who'll take over later on, who's like very charming, very laid down, but her writing skills and her communication skills are just off the roof. I have to use those kind of words because we have 16 to, we have guys who are woke around here. So if Ida is in the room, Ida, I will stop there and hand it over to you. But ladies and gentlemen, as we go through this, we will ask you for your name and your email, the name that you would want to appear on the certificate that we're going to give you at the end of the third workshop. This workshop is only going to last for 2 hours. We want it to be very interesting. So there's a time we'll take a break and go to Q&A where we'd want you to chime in, give us your input, because this is not only for us. We're not doing this to show off what we've done. Well, of course, we're showing off what we've done on the chat project, but we also want you to let us know what are the gaps and what we can do better. So there's going to be a session where it's just you giving us feedback. Ida, over to you. I'll stop there.
Thank you so much, Lizzie. I don't like it that you called Irene charming and I'm not charming.
Oh, my bad. Coffee later.
Right, thank you so much, Lizzie, for setting the stage. And of course, as Lizzie mentioned, my name is Ida Munzati. I'm a journalist and an SRHR influencer and content creator. Of course, later on, Irene Musila will be joining in as a moderator as well for the second session. But at this particular time, allow me to welcome Robert, who is the keynote speaker. He is from NANRI, as Lizzie mentioned, one of the partners, of course, for the SHARP project. And NANRI is a network of African national human rights institutions. So, Robert Athewa, if you can unmute and kindly just give your keynote address. Thank you.
Thank you, Ida. Thank you, Lizzie, for all that introduction and the brief that you've given. My name, as mentioned by Ida, is Robert Athewa, and I lead the program for SRHR at NANRI. And NANRI is the network of African national human rights institutions, as most of you may be aware. It is the umbrella body of all the national human rights institutions across the continent. And when we are talking about national human rights institutions, we are referring to, especially for the countries that are here, members that are here, we have SHRAG in Tanzania, that is the Commission for Human Rights and Good Governance. We have the Kenya National Commission on Human Rights here in Kenya. And of course, we have I've seen some colleagues from Uganda, the Uganda Human Rights Commission. In DRC, we have CNDH. In Zambia, we have the Human Rights Commission of Zambia. And these are the commissions that are mandated, established under the Paris Principles, to have oversight over all sorts of human rights in the country. So NANRI does not operate alone because we have a total of 46 NHRIs, that is National Human Rights Institutions across the continent. And in other continents, like in America, we have the Americas, we have Asia Pacific Forum in Asia, and then in Europe, we have ENRI, which is the European Network of National Human Rights Institutions. Sorry. And then also, sorry for that, we have a number of areas that we look at, but our general objective for establishing NANRI is to encourage the establishment of NHRIs in conformity with the Paris principles, of which I believe with time we will all create time to have a look at Paris principles and understand further what we mean by national human rights institutions. And then we also facilitate the coordination and strengthening as well as effectiveness of the NHRIs in Africa. And by this, we also encourage the cooperation of these national human rights institutions, intergovernmental institutions, as well as the civil society. And that explains why we are here. What is our mission? Our mission is to see an African continent with an enhanced human rights and justice for all. And our mission is to support the establishment and strengthening of NHRIs effectively undertake their mandate in line with the Paris principles that I've already mentioned. So presently we focus, we have key strategic objectives, and one of the objectives, as already mentioned, is to enhance the capacities, the capacity of NHRIs in Africa to deliver on their mandate. Our second objective is to enhance the promotion, protection, and fulfillment of human rights in the continent. And then our third strategic objective is to enhance the organizational development and institutional sustainability of NANRI as an organization. So allow me to talk about our approaches. We have three key approaches or strands that we use in addressing our specific aims in making sure that most appropriate means are applied for the desired ends. And here we talk of capacity strengthening support that we give to the NHRIs. We also have consultations and consensus building. And then we have strengthening the link between NHRIs and international and regional mechanisms. I know our colleagues are here from DRC, Zambia, and Kenya, giving more information on these approaches that on these issues that are mentioned. So I'll not belabor so much on these three areas that we focus on, but allow me to mention that our aim in this meeting is to create that collaborative working environment, as Lizzie and other speakers earlier on mentioned, so that we can be able to all move together in the spirit of leaving no one behind to address the issues of human rights across the continent. But again, allow me just to mention that when strengthening the link between NHRIs and international and regional mechanisms, we look at the Universal Periodic Review, we have the human rights areas that we look at in terms of reporting. We work closely with the African Commission on Human and People's Rights. We look at the implementation of decisions and judgments of regional bodies at national level. And here, my colleagues will, I hope, have a chance to also mention how this is being done. And then we look at the international justice complementarity, as well as looking at the engagement with sub-regional, regional, and international bodies. What are some of the ongoing programs at NANRI? We have a program on accreditation and capacity building to support NHRIs at the national level. We also link them at the regional level, and that is a regional Africa program on implementation of human rights commitments. And these commitments, we always talk about the Maputo Protocol. I know it will come up in this discussion, the Abuja Declaration, and others that are even in the other sectors like the AFTA under the business human rights, which is one of our programs. We have human rights defenders, we have sexual reproductive health and rights, we have climate justice, and then we also have implementation of the states of NHRI's recommendations. Ida, allow me just to mention that there are challenges here and there, because when there are coups, you'll find that in most cases, the most targeted institutions are the NHRIs. And we've seen this in Niger, we've seen this in Sudan. They will always want to stifle the voices of the masses by trying to make them, to gag them, including even the media. But in our case, the national human rights institutions, you'll notice that they are the voices of the masses. They are there to protect and promote your human rights. So my appeal is to all of us to work with all the national human rights institutions in our countries. I've mentioned some of them, the Uganda human rights institutions, if Nigerians are here, the Nigeria human rights institutions, the India's UFCNTH, and most of them have, most of the CSOs have come out clearly to spell out the engagement through the signing of memorandum of
I think we'll proceed from that. Of course, that was our keynote speaker, that is Robert Atewa. And he's basically just shared over what NANRI does, as well as basically just creating and giving us a background and basically the stage when it comes to adolescent sexual reproductive health and rights, and specifically to the topic of discussion today. So next, we are going to hear from Lucy B, and she'll be talking to us about what NHRIs are and do, and how they operate. That is from the health aspect, with a focus of adolescent sexual reproductive health. So Lucy B. Muntali is a Senior Education and Training Officer from Zambia Human Rights Commission. So Lucy, you can take the stage. But Lucy, before you do that, just to remind our participants, and thank you for those that are sending in their names, their emails for certification purposes. And just to remind you as well, which you may be aware, that we will be posting, and of course a link will be shared in the chat box, where you'll basically use the hashtag healthy adolescents. That is a hashtag healthy adolescents across all social media platforms. That is if it's X, Instagram, Facebook, LinkedIn. So the specific post links will be shared in the chat box, and you'll basically just commenting on them using the hashtag healthy adolescents. So Lucy, you can take up the stage. Thank you.
Good morning, everyone, and thank you so much to Ida for that lovely introduction. As mentioned, my name is Lucy Waliamontali. I know we have some participants here from Malawi, so some will probably think I'm also from Malawi. I do have relatives in Malawi, and Montali is a Tumbuka name, very common here in Zambia and also in Malawi. So special shout out to all people coming from Malawi. I don't know if you share my presentation. I had sent it, but maybe in case people want to put a face to the name, this is me. Hi, everybody. So I'll turn off my camera now. Okay. So next slide, please. Before it's gone a bit. Okay, so this is basically the outline of the presentation that I'll be making this morning. We'll basically define what national human rights institutions are. We'll look at some of their key characteristics, their mandate and functions, and basically what role national human rights institutions play in promoting and protecting the right to health, but more specific for adolescent sexual reproductive and health rights. The next slide, please. So in terms of who or what NHRIs are, NHRIs, that's the abbreviation for National Human Rights Institutions. These are state-mandated bodies in other countries such as ourselves. They call them independent state institutions, which are basically institutions very independent from government, but they're established to protect and promote human rights for all within the countries where they operate. So as you had heard when Robert was giving his keynote address, there are called different names in different countries. So for example, here, our National Human Rights institution is called the Human Rights Commission of Zambia. In other countries, they are called national commissions. In places like Botswana, I think they're known as the Office of the Ombudsperson. So these institutions are very key in the promotion and protection of rights in whichever countries that they operate. Our next slide, please. So our next slide will basically look at some of the characteristics of the national human rights institutions. So what are some of these? As earlier mentioned, I mentioned to you that NHRIs are independent state institutions. So basically, that means that they are not part of the government, but they are established by laws of that land or the constitution of that land. They are also independent state institutions in the sense that, aside from not being part of the government, governments in any one country have to show commitment that they are committed to promoting and protecting the rights of citizens within their respective countries. So as a show of commitment, wherever you find an NHRI, they need to have some funding from central government that shows that they are committed to promoting and protecting the rights of all citizens in that country. So this is the unique characteristic of the NHRI in that they're independent, but the funding comes from government. So basically it's an aspect of, a unique aspect of, sometimes with this independence, you kind of get to bite the hand that feeds you. You're independent, but you receive funding from government to ensure that rights are promoted and protected for all in that particular country. So another characteristics of national human rights institutions is that they are set up by a set of international standards, which are known as the Paris Principles. So I'm sure a number of you are wondering, what are these Paris Principles? So basically, these Paris Principles are a set of international standards which were approved by the United Nations General Assembly in 1993 that more or less guide the framework and establishment of national human rights institutions across the world, wherever they exist. So these principles basically spell out what the job of an NHRI is in terms of their function, mandates, how they're supposed to conduct their work, and who they should actually work with in the business of promoting and protecting rights for all. Another unique characteristic of NHRIs is that they act as a bridge between civil society and government. And a very classic example is really what is happening here this morning, and also on the SHARP project. I know Lizzie and Robert have already alluded to the fact that there are a number of stakeholders that are working on this project, to include civil society organizations, some faith-based organizations. So a special or unique characteristic of NHRIs is that they often act as a link between CSOs and government institutions. Another unique characteristic of NHRIs is that they hold governments accountable for their human rights obligations. We all know that the state has obligations to citizens in any one country, and the key ones are that they need to respect human rights, they need to fulfill human rights, And lastly, that they need to protect human rights. So NHRIs hold this special place of holding governments accountable to ensure that they are fulfilling these three key obligations that they are mandated to, that is respecting, fulfilling, and protecting human rights. Another characteristic is that they'll provide remedies for violations, and I'll speak to this shortly in the next slide when we begin looking at what are the specific functions and mandates of national human rights institutions. So they play a key role in ensuring access to justice and remedies for victims of human rights abuses or violations. Lastly, more often than not, national human rights institutions tend to be confused for civil society organizations or NGOs, but we are not NGOs. While we may work with other civil society organizations, NHRIs are very distinct from civil society organizations, because more often than not, sometimes we are seen to be more or less playing the same role that civil society does. But remember that unique aspect of being an independent state institution, that is one of the unique characteristics that makes us stand out. And also linking it to the aspect of us acting as a bridge between civil society and some government institutions. So we are confused to be NGOs. Even in Zambia, this has been the case for most of a long time. But we do try and inculcate by sharing information that we are set up by the Constitution and also act of laws that are acts of parliament. So we are not NGOs. We are very independent. We receive funding from government, but we are very independent in terms of how we carry out our work. So that is that about some of the unique characteristics of NHRIs. So now we move to the mandate and function of national human rights institutions. What are they? So if we look at the mandate and functions, they're basically broken down into four key categories. The first one being that of promoting human rights, the second one being protecting human rights, the third one being monitoring compliance to human rights standards, and the last, that of advocacy. So I'll speak to the first mandate, which is something I'm very passionate about and something that I do hold in my job portfolio here at the Human Rights Commission in Zambia, the aspect of promoting human rights. So how do national human rights institutions promote human rights? They do this in one of three ways: through human rights education programs, trainings or capacity building initiatives, and also conducting research on topic for human rights issues affecting citizens in any one country. That is one of the ways in which national human rights institutions promote human rights. So they do this by addressing a wide range of human rights. And I know a number of us here do know what human rights are and the specific categories of human rights, which include first generation, that's the civil and political rights, second generation, the economic, social, and cultural rights, and then the third generation, that is the group rights. So that is how they fulfill the promotion mandate. We now come to the protection mandate. How do NHRIs do this? So national human rights institutions, they have the authority to receive complaints of a human rights nature from members of the public. And this is done in one of two ways. The first and most simple way is we encourage members of the public who have been victims or who know someone who has been a victim of a human rights abuse to come and report these incidences so that we may investigate and then respond to them and eventually provide redress for the complaints that they have filed with us. Another initiative that national human rights institutions use to protect human rights is that they institute some of these investigations concerning human rights abuses on their own volition. So how do they do this? So basically how they do this is we have within the national human rights institution set up. People who pick up stories on social media, sometimes it's on the news and sometimes on the radio. So that is another way in which national human rights institutions can investigate. Another one is to monitor the human rights situation in any one country. So the monitoring can be based on investigating some of the violations that are reported to us. Sometimes it's through the research that national human rights institutions conduct themselves and compile in a report called the annual state of human rights reports that would detail the human rights situation in a country. And lastly, in terms of the mandate, NHRIs, they provide advice to governments and other stakeholders, and they engage with a number of international human rights mechanisms just to provide that human rights guidance. Next slide, please. So when you now look at the role of national human rights in promoting the right to health, it will basically fall into the same mandate that I've shared with you. So it's the role would literally cut across promoting, protecting, conducting advocacy, and monitoring compliance to human rights standards. But we'll skip this for now and just delve more specifically into what is the role of the National Human Rights Institution in the adolescent sexual reproductive health and rights. Next slide, please. We can move to the next slide. Okay. So like I mentioned, it still falls in the mandates and the functions that were earlier highlighted. But in terms of adolescent SRHR, when you look at the promotion mandates, the role of an NHRI is to conduct public awareness campaigns, that is to not only educate adolescents, but also communities about the importance of adolescent sexual reproductive health and rights, and also the importance of respecting these rights. We also conduct capacity building for various stakeholders who also include healthcare providers, community leaders, and other civil society organizations. In terms of reporting and promoting accountability, the role that an NHRI will play is that of preparing reports on the state of adolescent sexual reproductive health rights in their countries. So these reports will basically highlight progress, some of the challenges faced, and how the situation can be improved upon. And under this aspect, the NHRI can also use their findings to urge governments of their respective countries to take necessary action to address human rights violations, and also fulfill the commitments that they have made towards adolescent sexual reproductive health rights, either at the continental level or at the international level. Next slide, please. The next slide, please. Oh, thank you. And when you look at the protection mandate in terms of the role of an NHRI in adolescent sexual reproductive health rights, one of the key things that national human rights institutions do is that of investigating complaints of a human rights nature that are related to adolescent sexual reproductive health and rights. Why do they do so? This is basically to ensure that those who are responsible are held accountable for the violations that they've committed, and that those who've been victims get some form of justice for the violations that they have experienced. Then in terms of the monitoring compliance mandate, the role that an NHRI will play is that of monitoring the implementation of national laws. You look at issues of whether these laws do support the promotion of adolescent sexual reproductive health and rights. What do the policies say? What are other government programs and adolescents saying in relation to adolescent sexual reproductive health rights? And also under the monitoring compliance mandate, they can assess whether these programs or these issues I've mentioned are either effective or not in terms of promoting and protecting adolescents' sexual reproductive health and rights. Then in terms of advocacy, the role that an NHRI plays is that of advocating for the development, review, and implementation of laws and policies which protect and promote adolescent SRHR, ensuring that they're in line with international human rights standards. And we know that under SRHR, it's important to ensure that we make use of the AAAQ framework in terms of looking at accessibility, affordability, acceptability, and the quality of some of these services that are being
Lucy,
offered.
you can wind up. Sorry, you can wind up. Your time is almost
Yes,
up.
I'm almost done. I'm actually moving on to my last slide. So in terms of advocacy, that is what they're doing. We can move on to the last slide. Then you can also have collaborations. A classic example is what is going on in today's webinar. So NHRIs collaborate with different stakeholders who include government agencies, civil society organizations to promote a more comprehensive and coordinated approach towards the subject at hand. And lastly, NHRIs work to eliminate aspects of discriminatory laws and policies, such as those related to age of consent or criminalizing consensual sex activities amongst adolescents. So they also pay specific attention to the rights of vulnerable or marginalized groups in society, who include, especially among adolescents, who may include people who are living in poverty, people living with HIV, or adolescents who are living with disabilities. So in a nutshell, that is the role that an NHRI plays in the promotion and protection of sexual reproductive health and rights for adolescents. Thank you so much.
Right. Thank you so much, Lucy, for sharing. So to our participants, please feel free to, if you have any question, just point it out in the chat box. Of course, from that particular session, Lucy will be happy to be responding in the chat box. However, we'll also be having an open discussion in a few after the speaker that I'm just about to introduce, and we'll also be having a question and answer session. But just to let you know that you can still in the chat box, feel free to comment on what you're learning, if it's something new that you're learning, or if it's something that you knew and basically the session is just emphasizing on it. Please feel free to point that out in the chat section as well. Also remember, as I mentioned earlier on, will be basically you'll be using your social media platforms to post using the hashtag healthy adolescents. As I mentioned earlier on, a post, or rather a link to a post, will be shared in the chat box, and you'll just be commenting on it using healthy adolescents hashtag. So to our next speaker, of course, you can see him right there, whatever is being displayed, and he'll basically just be talking about human rights perspective from the country context. That is a sharp context. So I'm introducing Juma Safari, a human rights advisor at CNDH DRC. Junior, you can take up the stage.
Okay, thank you so much, Aida, for the speech. I will not be so long because my previous speaker has talked about the mandate of national human rights institutions and the role of NHRIs regarding promotion and protection. But I will emphasize here about some 4 points. The first one, I will talk about the introduction. After that, we'll talk about nowadays context of DRC, the newest one. Then follow with new perspectives regarding the collaborations between civil society organizations, the state, the Ministry of Health of DRC, and so on. So Population and health policies have been redirected worldwide following certain global recommendations to which the Democratic of Congo has agreed. These include, first, the International Conference, as you know, on Population and Development in Cairo with the adoption of the concept sexual and reproductive health. Second one, the Millennium Summits in New York in 2000 with the Millennium Development Goals. And the last one is the Global Strategy for Women's and Children's Health 2030 in connection with the Sustainable Development Goals. This strategy, as you know, aims to reduce by 10% the health risks affecting adolescents and young people, particularly sexual transmitted infections, STIs, and human immunodeficiency virus, early and unwanted pregnancies, alcoholism, drug addiction, as well as female morbidity due to gynecological cancers and other gender-based violences. Next slide, please. Several senior officials of the United Nations have been sounding the alarms for years about the rapid deterioration of the humanitarian situation in Eastern Democratic Republic of the Congo, which has become the global epicenter of conflict-related sexual violence. In the east of the DRC, women caught in the war, injury, and health ordeal and are exposed to sexual assault, infections, unwanted pregnancies, as well as unsafe abortion. Next, please. So, according to new context, during this crisis period, in the most affected areas, family and social structures are disrupted and educational and social services are interrupted. Adolescents are exposed and may become sexually active, with girls in particular being vulnerable to sexual assault and exploitation. This risk increase their vulnerability to sexual transmitted infections, unwanted pregnancies, and unsafe abortions. The growing attention to family planning and human rights, the consideration of equal relationship between men and women, particularly the individual rights regarding sexual and fertility, have provided a different view of the concept of reproduction that is no longer solely focused on the mother-child couple, and that also dissociates issues related to sexual from those of reproduction. Next, please. So consequently, the notion of risk-free maternity has been joined by that of risk-free sexuality, fighting against sexual violence, against female genital mutilation, against sexually transmitted disease and unwanted pregnancies, particularly among adolescents. The scope covered no longer considers exclusively medical concern, but also legal ones. Next, please. Before addressing more directly the pandemic context and the decision-making process that led to adoption of various public health protection measures, according to new perspective now in DRC, we want to highlight the standards that define women's rights and reproductive health. This exploration requires adopting a pluralistic and internormative approach. Indeed, several standards are not explicitly enshrined in laws or regulations adopted by the state. In DRC, we have many texts regarding locally and regionally, internationally, but that are not really made in place, that they are only voted and promulgated. But the real problem is implementing those rules of those laws. And now what CNDH is doing is collaborating with parliamentaries, members of parliament, with some members of government in order to implement those legal laws. However, in context where the intrinsic normativity of the health field is often perceived as just as, if not more, restrictive than positive law can be, a broad approach allows for the more precise specification of the range of rights recognized for women under, for example, recommendation and guidelines issued by international associations, as some may now reproductive health is general state of physical, mental, and social well-being related to all aspects of reproduction and is not limited to the mere absence of disease. Reproductive health includes the ability to enjoy a satisfying and risk-free sexual life. It involves the ability and freedom to procreate according to the timing and pace desired by the individual, as well as the freedom of non-procreation. That is what the DRC-NHRS is monitoring and promoting, so that all women or adolescents must be aware of that. Men and women have the right to obtain information and access to means of controlling their fertility, as well as the right to access healthcare services that allow for a safe pregnancy and childbirth. Reproductive rights are not limited to access the reproductive health services. They also include in DRC, in particular, the right to contraception and to voluntary termination of pregnancy. They also imply the eradication of forced sterilizations as practiced in certain developing countries. We will consider here the perspective that emerged from the major international conferences related to population on the one hand and women's rights on the other. Then we will focus on same questions raised by an approach to reproductive rights as human rights. Are reproductive rights a new category or right? No, it's the same category of human rights as we know. As we can say, are human rights truly universal or potentially universalizable? No, they are universal. So as conclusion, what I want to conclude, the human rights situation in the DRC requires urgent attention and concrete actions from the international community to protect civilians and put an end to the systematic violation of fundamental rights. Efforts to establish peace and stability in the region are essential to improve the lives of millions of Congolese affected by this crisis. For example, in the eastern part, now there is a problem, a very big problem of attending the health spaces because of the war, and adolescents are not really protected. Let us remember that the eastern part of the Democratic Republic of Congo is experiencing a recurrent crisis situation due to the aggressions from neighboring countries, as well as the presence of armed groups that are at the root of the recurring displacement of populations, with young people increasingly exposed to situation jeopardizing their normal growth. Next, please. The current working context of the CNDH-DRC aims to collaborate with all stakeholders on sexual and reproductive rights to provide knowledge and tools to effectively advocate for the sexual and reproductive rights of adolescents and youth within national and regional human rights frameworks, including commitments made under international instruments such as the Abuja Declaration, the Maputo Protocol, ICPT 25, etc., etc. The DRC-NHRI, like all NHRIs in the world, in accordance with their mandates clearly outlined in the Paris Principles, plays a crucial role in promoting inclusive societies that guarantee reproductive health and rights for all, but their essential voices are lacking in the spaces where decisions are made across the country. Next, please. Thus, the end, close collaboration between the CNDH-DRC and stakeholders in sexual and reproductive rights in Kinshasa, as well as in the provinces or regions, is always prioritized to ensure changes and an impact in the realizations of sexual and reproductive rights for all, and to constantly monitor and report on the state's obligations regarding the respect of sexual and reproductive rights. This is what we call accountability. Thank you very much. Merci beaucoup. Asante Matondo Mingi.
Hello.
Thank you so much, Junior, for being brief and for letting our participants understand more about human rights. So basically, as you've said, human rights are universal, and you helped us in painting the picture in the Democratic Republic of Congo. And just to let our participants know that, of course, that was the perspective of the Democratic Republic of Congo. Remember, the SHARP project is being implemented in the Great Lake region countries. Of course, we'll be hearing more from the perspective that is in Kenya, in Zambia, in Burundi, and Rwanda in the sessions that, of course, will be following. And of course, just that is for Zambia and Kenya, we'll be listening in the next session that will be moderated by Irene. So it's now time for the question and answer. And for the participants, I know that you've been sharing your name and your email, that is for certification. I can see that there is a poll that has been shared. So in the poll, just go to the poll and make sure that you're indicating your name as you want it to be to appear in the certificate. So just go to the poll, write your name as well as your email address. I know that you are putting them or rather writing them in the chat box. Just go to the poll that has been shared and make sure that you're writing your name as well as your email. So just the way the poll has been shared, a link will also be shared. That is a post that will have been made on different social media platforms, on Facebook, on Twitter, on Instagram, on LinkedIn. And for you as the participant, you'll just go in the comment section of that particular post, and then you'll basically just be commenting and sharing what you're learning using the hashtag healthy adolescents. Yeah, so just to let you know that the poll is on your screen. You can see there's a part that is indicating recording on your left. Then after that, you will see something like buzz. Yeah, it's written poll in progress. So you can just tap on that particular part. Then you'll be able to write your name as well as your email. That is for certification. And let us now open it up to questions. Dear participants, if you have any question, Tanatwa, if you just look at your screen on the left part, you will see something like bar, like 3 bars. Yeah, you can just tap on that. Then you'll be able to see the poll and share your name as well as your email address. So just look at the left side of your screen. Then you will see the 3 bars that are appearing there. Then you'll be able to key in, that is your name as well as your email for certification purposes. Make sure that you're writing your name as you'll want it to appear in the certificate. So we are just going to take a few minutes to take questions from the participants. So if you have any question, you'll basically just raise your hand, or you can still type your question in the chat box, and our 2 speakers, that is Lucy and Junior, will be happy to respond to your questions. If you have any questions.
Yes, we have Ruyon, Joseph, Jessica, Awino, and Nambatia Christine who have raised their hand.
Lizzie, is the poll supposed to be country and email or name as well?
We will redo the poll again, so no worries. Yeah, no worries. So I think let's take the questions from Ruyon, Joseph. Please feel free to unmute yourself.
Thanks for the opportunity once again. It's a privilege to be here. My question, the first question goes to from Robert, and it's about the human rights. And it reads, how best can human rights institutions work with the government agencies? This is because when you look at it, it mentioned something about coups in African countries, that is uprising. and there tend to be rivalries between the government agencies and the NGOs. And also, Lucy also highlighted that the human rights institutions are not NGOs and civil society as well. So how best can we find a positive ground in which we can, because there are a lot of people that are working in government and they look at NGOs as, or the human rights activists as people that are against them. Secondly, the funding comes from the West mostly. For example, this program is funded by the European Union. So I feel that the governments or the agencies feel that they are left out. How can we create that environment? That's my first question. And then the second question comes in as well from Lucy's presentation. She as well mentioned something about, I asked, who is the judge? Because when we look at this, there are a lot of imbalances between what is defined as human rights and there is neglect of traditional and the religious leaders, and then the family heads of units. Thank you so much.
Lucy, you can respond, and for response, you only have 1 minute, so that you also give an opportunity to the other participants to ask. Thank you.
Thanks, Ida. I think for me, the only thing I will respond to is Joseph's, I think, comment around NHRI is being perceived as NGOs and how, I mean, NHRI is being perceived as being part of civil society or NGOs, and if an NHRI is not, how then can we best work together? So I would just basically share an experience from our point of view, like working for the Human Rights Commission in Zambia. If we're to bring on board, say maybe wanted to work with a civil society organization or an NGO, we have in place here at the Commission what we call a stakeholder engagement manual that we use to vet the kind of civil society that we should work with as an institution. Because at the end of the day, you want to work with people who are credible, people who share the same interests with you, and people who are ideally concerned about the promotion and protection of human rights. So we use this stakeholder engagement manual to assess whether our NHRI is in sync with the ideals of this civil society organization that we intend to work with. So that manual basically helps us vet the kind of civil society we should work with, because at the end of the day, this boils down to issues of integrity and credibility of the institution. So we need to make sure that we are working with civil societies or NGOs that are credible, that have a good reputation within the Zambian society, and are ultimately interested in the promotion and protecting of human rights. And
All
then
right,
concerning the aspect of where maybe tradition and human rights intersect, obviously we have to find some form of common ground in terms of because not really an aspect of really looking at who the judge is here. We need to meet, there needs to be some form of intersection at both where tradition and human rights meet. I know I don't have a lot of time, but I hope, Joseph, that has answered your question.
Okay, thank you, Lucy. If the response has not been comprehensive enough, please feel free just to type your response in the chat. I'm sure Joseph will be able to follow that there. So I'm going to give an opportunity to Jessica. You can ask your question. Please make it brief, and the response as well will be brief. Thank you, Jessica. You can take it up.
Thank you so much, Ida, for this opportunity. My question was this, and I think anyone can respond to it, and I would love for you, Ida, to respond on it. So when talking issues of comprehensive sexuality education, mostly in Kenya, you realize it's facing a lot of oppositions, more so in schools, where teachers really do not understand where it's coming from, or rather its importance. But as a SRH, I mean, sexual reproductive health advocates, we truly do understand that it's of really of good importance for our children to really be taught on that particular education. So I don't know what strategies, particularly in this project, what strategies are you going to use just to be able to go through schools and be able to maybe impact the schools? And also, when you're talking about this particular project, how is it community owned, rather community based, so that it has a long lasting impact and also its sustainability will not be shaky? Yeah, thank you so much.
Thank you, Jessica, for that. So, Junior, you mind responding to that, the issues of comprehensive sexuality education in schools, the community, and the opposition that comprehensive sexuality education is facing? Junior, if you can take it up and kindly just respond briefly because we do not have time.
Yeah, briefly, what I can say is, according to DRC context, what we are advocating with all stakeholders, especially the Ministry of Education, National Ministry of Education, DRC, is how to accommodate the program, the school program, in order to include the sexual reproductive health in the space of what we call civic education course. And that was agreed by the ministry, but we are waiting for the letter of instruction letter that must be implemented by all schools in DRC. That was agreed by the ministry. So that is important because of the knowledge of adolescents in DRC. So that's what I can say, what has been done in DRC as advocating about it. Thank you.
Thank you so much, Junior, for being brief. Kindly, Christine Tanatswa Nisengwe Juma, if you can kindly just type your question in the chat. Make sure that you're directing it to the two speakers. Whom specifically would you want to respond, or you can just share your question and they'll be able to respond in the chat box. So kindly just type your question in the chat box, and Junior together with Lucy will be able to respond. And that is the end of this particular session. I'm now going to hand it over to the charming Irene. Irene, if you can take it up and take us through the second session.
Hi guys, thank you so much, Ida, and to the previous speakers, thank you for such an important discussion. So without further ado, I will introduce the next speakers. We have two more speakers and then a Q&A, but after the first speaker, we'll also bring back the poll questions. So allow me to introduce Elijah Rotok, that will be our next speaker. Elijah, over to you.
Thank you very much, Irene. My name is Elijah Rotok. I do serve at the Kenya National Commission on Human Rights as a senior human rights officer. So my presentation would be on the perspective of human rights institutions in conducting public inquiries. Allow me to share my screen for purposes of presentation, and I'll go straight to the same. Okay. Okay, I hope that's visible enough. Let me put it on presentation. Is that okay?
Yeah, we can see.
Yes, it is.
Okay, thank you. So the Kenya National Commission on Human Rights is a constitutional body that is established within our constitution. It meets the principles under the PARI that has accredited the commission as an A-status national human rights institution. So it acts as a watchdog over the government entities and in terms of checking the status of human rights and also monitoring. And also it provides leadership towards the promotion and protection of human rights in Kenya. So part of achieving this mandate includes a provision of investigations, providing redress mechanisms, conducting appropriate research, and also educating members of the public in general on matters relating to human rights, and also working towards institutional reforms, which includes policy review, amendment of legislation, among others. So it also does a bit of advocacy towards the implementation of the existing policy frameworks, and also has that international reporting mechanism in matters human rights and the obligations that our country has had. I would want to use this case example of a public inquiry that was conducted and reported in 2012, where we were looking at the realization of sexual reproductive health rights in Kenya. This inquiry was based on a complaint that was received and lodged at the commission by the Federation of Women Lawyers and the Center for Reproductive Rights regarding the systemic violation of health rights, especially at the health facilities. Concerns around the quality of service, which were considered as poor, and the lack of necessary infrastructure, supplies, and the needs of individuals who are visiting our healthcare facilities were not being met. And so the KNCHR commissioned a public inquiry to now look into the realization of reproductive health rights in Kenya, and this was in line with, of course, our mandate, which provides the Commission an opportunity to institute out of its own motion. It can institute as complaints or institute fact-finding missions into a systemic issue. So some of the objectives of this inquiry was we needed to look at the legal and policy framework governing the implementation of sexual and reproductive rights in Kenya, and also we were to look at the extent to which both the state and non-state actors are complying with the obligations in relation to SRHR. Also to check what was the extent of the awareness and pursuit of sexual and reproductive health rights in Kenya, and also to identify and document cases of sexual and reproductive health rights where there's been violation. We based this on a human rights-based approach framework, which looked into sexual and reproductive rights by checking the policy environment, and also assessing what would be the priorities to improve the service delivery, especially at the local level and also at the national level, and also to have an analysis of the 4As and Qs had been mentioned previously, where we look at the accessibility, availability, acceptability, and even the quality of sexual and reproductive health and rights that has been issued at various facilities. And this, of course, was in reference to the general comment number 14 of the ECOSOC rights. So some of the considerations that we had in terms of conducting this inquiry was that because of the sensitivity of the issues that may arise, especially for sexual minorities, think about intersex persons, lesbian, gay, sex, then we required reconnaissance visits to be undertaken to evaluate, of course, the risks of collecting some of this data because of the sensitivity and the legality issues that might arise relating to the same. Also, there was need for consent by respondents, especially when we are dealing with youth and children, and also to inform the public of the objectives of the inquiry that we wanted, and we wanted to encourage the voluntary participation. Also, concerns around confidentiality of the kind of interviews and how the processes would be done was imperative and important. And especially to the respondents, that not only would we maintain their confidentiality, but also that they were at liberty to withdraw their consent or at any point during these interviews. Some of the target groups included children, orphans, adolescents, widows, elderly persons, persons with disability, apologies for that, and then persons living with HIV and AIDS, sexual minorities, IDPs, refugees, migrant workers, persons who are participating in surrogacy arrangements, among others. Some of the key concerns that and violations that we were able to document at that time included, we got reports about rape, sodomy, defilement, forced circumcision, forced abortion, forced child marriages, female genital mutilation, discrimination and stigma while accessing services, harassment and mistreatment at the health facilities, difficulties in accessing the facilities because of not only infrastructure, but also distance. Also, the
Sorry, Elijah, I think we lost you for a minute.
I hope you can hear me.
Yes, yes.
Please, I can retake the part that I left. Should I go, where should I retrace my presentation?
You can start from harassment and mistreatment.
Oh, okay, thank you. So there was harassment, reports of harassment and mistreatment, especially of the youth and adolescents at the health facilities when they were seeking sexual reproductive rights services. And this also applied to the other segments of the society, and especially for vulnerable and marginalized groups. We also noted not only questions of access in terms of distance, but also some of the infrastructure were not accessible for persons with disabilities. And also the concern about the information in terms of what are my options as an individual who is seeking sexual and reproductive health and rights services within the facility. So think about the commodities that are available, issues even around contraceptives and so on were things that emerged. Also, the non-involvement of the service, the end user in terms of the decisions that are affecting them medically came out also as a key concern.
Elijah, I'm sorry to stop you for a minute, but you only got 5 minutes, so.
Should I take that again?
You only have 5 minutes left. Can you hear me? Elijah? Well, I guess Elijah has got some connection issues, and before he gets.
I hope I'm audible.
Yes, you are. You've got only 4 minutes left. Carry on, please.
I think we proceed. He might be having technical difficulties. Elijah will try and bring you back into the conversation. Could you double check your connection, please, Elijah? In the meantime, Irene, let's just proceed.
Okay, guys, seems like Elijah's got some internet connections. And before even we carry on, I just realized that everybody else introduced me, but I never got the chance to introduce myself. So allow me to introduce myself. My name is Irene Musila. I'm a communication specialist, but I'm also a SRH champion. So yeah, I'm glad to have you all, and I'm also amazing, according to Lizzie. And Ida, I'm so sorry that I'm amazing and you're not, but you'll always be amazing to me. So yeah, I just realized that you have more than 16 countries represented in this conversation, which is so important for sharing diverse perspectives and strengthening global efforts to advance SRH. And by collaborating, we can address challenges, share solutions, and make sure that all adolescents have access to the support and protection they deserve. And these conversations drive meaningful change on a global scale. So thank you, all of you from all over the continent. Allow me to introduce the next speaker. We'll definitely come back to Elijah. Our next speaker is Lisbon Chamwe. He is the manager of Zambia Human Rights Commission. And the floor is yours, Lisbon. Welcome. Lisbon?
Hello?
Not sure.
Hello?
Hello, Lisbon. Yes, we can hear you.
Yes, thank you.
Okay.
How are you?
Good, good. The floor is yours. You've got only 15 minutes.
Okay. Thank you so much. I think someone can share for me. I'm using their phone. I'll try by all means to try and do as much as I can. Well, yeah, again, good morning. I don't know whether it's already afternoon that side. My name is Lisbon Chamwe. I work for the Human Rights Commission in Zambia. I'm the manager for research and mechanism, responsible for issues to do with state compliance and many other issues. Okay, in particular, this time around, I'm just looking at a case study. I think most of the issues Rusi has touched on them in relation to the issues to do with the role of the National Human Rights Institution. So basically, what I will just speak to the fact that when you look at the world, we are seeing there are a lot of issues relating to sexual reproductive health rights, especially for adolescents. Zambia, in particular, is one of those that are facing a number of these issues. And there are multiple factors, basically, that contribute to this particular issue. Among the key issues that we see, you can change for me. I'll be a bit fast. I hope you are getting me. Are you?
Yes, we are. Yes, we are.
Okay, yeah, we can move the screen.
Yeah.
Okay. So among the key issues that the state that affect issues of sexual reproductive health rights, others stem from the fact that there are barriers that exist in different societies in terms of accessing contraceptions and many other commodities that relates to issues of sexual reproductive health rights, especially for adolescents. Others could stem from policies, others come from laws, others is because of certain customs that exist within that particular issue. And the other issue that we see basically is when you look at customs, they determine on who is an adult, who is not an adult. And you will find that sometimes this is what results into other children being abused. The other thing is that there is lack of adolescent-friendly corners in most of the societies around. If you carry out maybe monitoring, you realize that maybe only a few facilities, and most of these facilities were run by NGOs, with a few, if at all, for the government, where maybe there are elements of excellence. Can move on. So another issue, if you look at the aspect that makes these issues continue, the fact that there is lack of awareness, very limited, very few people tend to get this information, especially adolescents. If they are to ask a question, they will be bad based on either customs or laws on other issues. And then the other challenge that is there is there are legal challenges and gaps within the law. And if you look at issues to do with the health rights, in as much as we know for sure that this time around, if you look at Zambia, we have what we call the Children's Code Act. Basically, this Children's Code Act has brought in a chance for children to be protected in one way or the other. But you know, the law, the way it's couched in Zambia, when you look at the constitution, it says anything that is contrary to the constitution, to the extent of its contract, is considered void. So to some extent, one can still get back to say, why is this child enjoying these rights when they are not enshrined in the Bill of Rights? So that itself is a challenge to effective promotion of these rights. Let's move on. So I'll begin with this particular case study. As you may be aware, these issues are issues that have been spoken, a lot of people have spoken, and mostly, if you look at Zambia, the Human Rights Commission, we began to profile maybe state of human rights way back in 2007. But of course, we were doing what we call thematic approach until 2013, when we thought it's important for us maybe to take into account of the fact that human rights are interdependent. So as much as we may want to focus on a particular thing, we should take out everything. But nevertheless, what we've come to realize is that these thematic issues, they were leaving out. And then at the same time, when you look at the comprehensive aspect, when you look at the aspect, they were not per se helping, in the sense that we were leaving out some of the most important issues relating to adolescents. Therefore, in 2023, the Commission, through its mandate of monitoring state compliance to issues of human rights standards, and through the production of the State of Human Rights, what we call the Annual State of Human Rights, I think Lulu touched on this, we included a component that relates to adolescent sexual reproductive health rights. And this component related to the rights of the children, in particular, the girl child that was every now and then reported to have been abused. And that's how we carried out a component. We had indicators relating to this. And if you check on the findings on the table that is following, okay, move. If you look at the table itself, you will see that we targeted information relating to information that related to 2021 activities and 2022 activities. We went to the same district, and when we collected information on the information that was reported, that is, either in the hospital or information that was reported in schools, you realize that in 2021, cases that they had recorded were 353. But because of the fact that out there people had begun, including the human rights, to talk about these issues, raising awareness and the importance of these matters reported, we saw a change in 2022 where the numbers now increased. That showed that a lot of children were being abused. If you look at, it was more than 1,000 from the same district. And then that's how the commission realized that we can begin to focus on these issues as well. So much to the extent that we take keen interest. In Zambia, one thing you should know is that any child or a girl who has carnal knowledge with another man, whether she's willing or not, as long as they are below the age of 16, that case is classified as defilement. Issues of consent is material. So we thought of making sure that let's begin to profile on these matters so that we can have an interest of monitoring and see if at all we can help. Let's move on. Therefore, what happened was this, the commission collected this information and realized that the state, to some extent, had not put in stiff or stringent measures, especially in the rural areas where children were every now and then reported, especially the girl child, impregnated at an early stage. So the commission moved in, and that's how we had to develop that particular table. And then what followed, like one from Kenya spoke, one of the mandate of the commission is to investigate. One of the tools that we use in investigations as national human rights institution is conducting what we call public hearing. So what happened was the country, through support from Save the Children, we carried out public hearing in selected areas so that we could hear exactly what was happening. As you may be aware, when you look at issues of early marriages, teen pregnancies, and because of the aspect of cultural practices that tend to come in, what we see is a situation that these become systemic human rights issues. And to break through systemic human rights issues is a bit difficult because the system tends to justify certain actions. For example, the system of custom. You will find that someone will argue that it's within our custom that a girl who has come of this age is a girl who is at this level.
Lisbon, you've only got 4 minutes left.
Okay. So the issue that came in at the end of the day, we managed to raise awareness, and from the raising of awareness, what we've come to have is that now stakeholders have come in and we're able to collaborate. And one of the stakeholders I can tell you is the schools. So at some point, one girl aged 14 was impregnated, and they realized the girl was not reporting for school, and they followed up the matter and found that the girl was pregnant, and the matter was brought to the attention of the commission. And the commission, in working with Zambia police, they managed to report this matter, and this case was followed. And what happened was, when the information went out, this particular man who was accused, to the uncle to the girl who impregnated, what did he do? He ran away. The family members, especially the mother to the girl, was in support of the situation. Says, no, the uncle can't do this. And then from there, it's okay if she gets pregnant because we can call the man. And when you look at those matters, a crime has already been committed. We followed up the matter. And this man, when he ran away, we used the community members to identify the relatives who could help us trace. So in short, what I can say is that most of the times when you look at National Human Rights Commission, we have a broader mandate, and this mandate includes investigations, collaborating, and like now, the Human Rights Commission has got a mandate to litigate on behalf of its clients. So we can take advantage, and that's the case that I can tell you. We followed it up, and the police are on it, and this particular person is being prosecuted. And if you look at deferment in Zambia, it has a minimum of 15 years once convicted. So to some extent, I can say that in terms of deferment, the Human Rights Commission tend to come in. Why? Because they want to promote on the rights of these children in terms of sexual reproductive health rights. But unfortunately, when you look at cultural aspect, this particular child refused to terminate the pregnancy and said in her culture is not supposed to do that. Of course, her right was it was her right, but at the end of the day, we know for sure that sometimes as young as she is to begin to raise a family against her will, it becomes a challenge. But it was a bit difficult. But we had to bring in social welfare to provide shelter so that the man who defiled does not continue to repeat. Even if the man would be on police bond, on bail, that person will not have access to this particular child. So that's how the Human Rights Commission or National Human Rights Commission come in based on its broad mandate. I think in a nutshell, that's what I can say. Or what I can say in conclusion is that let's work together. Let's have a multifaceted approach, because this particular face does this, the other face does this, the other face does this. At the end of the day, we are getting to the goal of promoting and protecting the rights of the children, particularly adolescent sexual reproductive health rate, and we'll realize that. Thank you so much.
Thank you so much, Lisbon. We're now moving on to the Q&A section. So welcome to the Q&A. If you're itching to ask something, drop it in the chat or raise your virtual hand. We're all here to learn and grow together. And a quick reminder, please stay on mute unless you're speaking. And if you're not familiar with the Zoom hand raise function yet, now it's your chance to give it a go. So yeah, we're ready for the Q&A. I think Elijah and Lisbon, the rest of the speakers are ready. So let's go. Also, the poll question is back. I've seen so many people in the chat asking if the poll question is back. The poll question is back, so now you can answer that. And as you answer that, if you have a question, now is the time to ask. Please don't be shy.
Irene, so we already have two people, Simon Nisengwe and Bartolomeo, whose hands are up. And after the two, maybe you can take the questions on the Q&A chat option. Thank you.
All right. Okay, let's start with Simon.
Oh yeah, and Simon, before you go on, ladies and gentlemen, we only have a couple of people left. Please, the names and the email address really matter, because this is how we will write the names on the certificate and where we will send it after. So if you do not include your details here, we will miss you out. So please feel free and kind of respond to that. Simon, over to you.
Thank you so much. Well, my name is Simone Nisingwe. I'm a youth advocate from Rwanda, and my question goes directly to Lisbon. And I get word on the data which he presented, and I would like to know what is being done currently with government of Zambia in PAC for other organizations to ensure that child marriage is being taken on the round table, just to find a sustainable solution, because that seems to be a very big direct issue. So that I would like to know what is being done for government of Zambia to ensure that they have sustainable solution to protect these children from violence. Thank you. Over to you, Liz. I finished my question.
Over to you, Lisbon.
Okay, thank you so much for the question. What I can say is that based on these statistics that are coming through, what it has happened is that the Human Rights Commission, as the National Human Rights Commission, has been co-opted on a technical working group that is, of course, reviewing the previous strategy that was put in. So we are as well part and parcel of the team that is currently developing what we call a strategy to end child marriage and teenager pregnancies. And we are on board. I think we are almost done with that thing. We're just waiting for it to be approved by cabinet so that it can be rolled down to implementation. So basically what is there in Zambia, we have a division called Gender Division under the Office of the President Cabinet Office. And that is the department that is entrusted with the mandate to coordinate on issues relating to gender and other issues. So that is the one that is coordinated. But currently the Human Rights Commission is part of that particular team to make sure that we have a strategy that we use to make sure that we end. And of course, some of the issues I can state that are in the strategies to make sure that we begin to raise awareness against what we call repugnant cultural beliefs. When we talk about repugnant, are those that are repugnant to the natural, when you look at the natural justice, and human rights. So one of it, you can't allow a situation that it's accustomed to allow a child, someone who is a child, both medically and legally, to be married off or allowed or to be impregnated. So basically, those are the issues. We want to target on those areas that we know that they are fueling these issues and make sure that maybe at the end of the day, we do away with the barriers that tend to affect these issues. That's what I can say for now.
Thank you so much, Lisbon. Anyone with a question before we go to the chat? Because I can see also speakers are trying to answer all your questions on the chat box. So if you do have a question, please raise your hand or just type it on the chat box.
So we have Bartolomeo's hand up. Please, you can unmute yourself.
Okay, thank you very much. It's a very enlightening session in the last hour. So my question is around the challenges of adolescents and young persons, especially those who are not necessarily living with their parents and they are not really at the official age of consent, like in Nigeria, 18 years. But they also have issues, maybe at 13, at 14, they have sexual reproductive health issues. How do you deal with that in a service, from a service delivery perspective, as it affects the role that the national human rights institutions in Africa can, what role can they play to ensure that these ones access services even without consent of parents? Thank you. I hope my question is clearly understood. Thank you.
Thank you. I'm gonna, Elijah, would you mind answering this?
I thank you very much. I hope you can hear me. Thank you, Bartolomeo, for your question, especially regarding girls and generally young persons and adolescents who are seeking help and have not yet attained the age of 18. First, from the onset, is that the persons who go to hospital or to the health facilities should be regarded as clients who require these services, and that does not limit the accessibility of critical information. For instance, a child who is pregnant should be given the requisite services, including prenatal care, be informed about the processes and the manner in which the hospitals will handle them, of course, would be crisis pregnancies because of the nature of the development of the child at that point in time. And so there is more need for a specific specific care provided for these children to ensure that they are able to attain their standards of health. This, however, at times is faced in terms of, it faces challenges, especially in terms of the frowning upon children who go to seek services, even the tone and also the manner in which communication at times is done is from a perspective of you are a bad example to the society, or you have done something that is very wrong. And even the reporting mechanism and referral pathways are more towards at times reporting this child either to face criminal charges together with the person who either defiled them. And so taking up this, some of the services might be clouded with access to justice or the other processes of trying to find the persons who violated the child. That
okay. All right. Thank you so much, Elijah. We only have like 3 minutes left for the questions. I'm just going to read a few questions in the chat. And the first question goes to Robert, that is by Penina Wanjoy. If NHRIS is government funded, which I understand gives them independence, does it also mean the government interest will dictate the directions of most NHRIS? Could also this be the main reason why most of them are not fully functional or addressing the human rights violations effectively? Is the dependency sustainable or applicable? Robert, over to you.
Hello, sorry, I didn't get it so well, Irene. I don't know if you could just.
So, Robert, the question is, if NHRIS is government funded, which I understand gives them independence, does it also mean the government interest will dictate the directions of most NHRIS? Could also this be the main reason for why most of them are not fully functional or addressing the human rights violations effectively? Is the dependency sustainable or applicable?
Yeah, well, actually, and I know my colleagues are here, they can as well. But the issue of independence, you know, these are commissions, and I'll give a good example of the Kenya National Commission on Human Rights. Kenyans in the house, you can easily tell when you heard of some of these statements coming from the National Commission on Human Rights. They come out strongly in the sense that when they speak, the government listens, because it is not just issuing statements. Whatever they say does not end just by issuing the statement, because it goes beyond the regional, the country's borders, addressing these issues also at the regional level. Because we have what I didn't mention, GANRI, Global Alliance of National Human Rights Institutions, which brings together all these national human rights institutions globally. And there is what we call accreditation. So if NHRIs are not playing their role, you find that some of them, I don't want to mention, their statuses are lowered, let's say to B status. It means they are not performing their mandate as per the Paris principles. So for them to fully perform their mandate, they need to also have the budgets. And we know in Africa, most of the budgets are not enough. And with that, that's why we reach out also to collaborate with CSOs, work with any other partner within the specific country to be able to address these issues fully. Did I answer you, Irene?
Yes, but due to time,
Thank you
I
so
felt-
much.
Okay.
Thank you so much, Robert. So we are running out of time, and my next question will go to Lucy. If the NHRIS monitors a human rights violation, which is government inflicted, as in currently in Kenya, and actually identifies as such, to whom will they report to for? Sorry, let me just read the question again. If the NHRIS monitors a human rights violations, which is government conflicted, as in currently in Kenya, that is in brackets, and actually identifies it as such, to whom will they report to or forward the issue to? What means do they use to ensure justice is served to survivors? That goes to Lucy. Hello, can you hear me?
Yes, we can maybe hand it over to somebody else. I don't think Lucy is on the call. Lucy, are you
All
there?
right.
Maybe Elijah can take it up.
Okay.
Thank you for that question. The Commission has a reporting mechanism to the National Assembly. When it did the inquiry, it submitted to the President, and also it has the international reporting mechanism where it has affiliate status. For example, the African Committee on the Rights and Welfare of the Child. It also provides shadow reports through the UPR process, where youth participation and especially civil society organizations submit their shadow reports and provide context reviews on the same. So there are various ways, and also for justice for survivors, apart from just providing either psychosocial support and taking up cases, we've gone to court specifically to support some of the cases, especially to help women who've been detained in hospitals because of not paying medical bills, and even for those who've lost their lives, especially when their bills go very high. Also, there are various petitions, and also through negotiations, we've been able to engage with various hospitals to have improvement plans for purposes of enhancing their services and within the, and also provide local context solutions. I'll leave it at that. Over to you.
Thank you so much, Elijah, and thank you for the questions, participants and speakers. As we wrap this up, I encourage you all to take what you've learned today, education or community action. You know, let's work together to ensure every adolescent has access to their sexual and reproductive rights. Your efforts matter, and together, genuinely, we can create a lasting change. Thank you so much, and thank you to all the speakers and to my fellow moderator, Ida. Thank you, and to our host, Lizzie. Allow me to hand it over back to Medrap, and yeah, talk to you soon.
Tinkerbell, if you can take over, that would be awesome.
Hi, everyone. Thank you all for joining today's virtual meeting. I would like to just extend my special gratitude to our speakers for sharing their valuable insights. We appreciate the productive discussions and all the updates that have been shared. I just want to also announce that our next workshop is scheduled for August 26th. That's in a few weeks' time. And MEDRAP is going to spearhead this workshop. MEDRAP stands for Medicines Research and Access Platform, and we are the ones spearheading the SHARP project in Zambia. So maybe just a few topics that we're going to explore. The key topics are the role of Medicines Transparency Alliance in SRH advocacy in Zambia. We'll also look at the role of the Islamic religion in SRH advocacy in Africa, the role of the church in SRH advocacy in Africa. We'll also have our adolescents to talk about their needs and perspectives, and also insights from policymakers. We'll have the Ministry of Health, who's going to talk about SRH advocacy efforts. So we shall share more details soon, and yeah, we'll keep you posted. Have a great day, and let's stay connected. Thank you so much.
Thank you, Medrap. Thank you, Tinka. Thank you, everyone, for joining. Please use the hashtag Healthy Adolescents when you're posting, and looking forward to meeting you in the next call. Because you've attended the first one, we will send you a direct link and calendar invite, because for the next webinar, it's going to be closed only for people who attended the first one. Have a great day, a great afternoon ahead. Asante.
Thank you. Thank you. Bye.
Thank you, Asante.
Thank you.